My name is Matt Lehman, and I'm a teacher and the athletic director at Concord Community Schools. I've been there 26 years. And my job requires, being the athletic director, it's really a high octane move from one place to the other type of job. And I started having some issues with pain in my, originally, I thought it was back. It was kind of back, hip. So I was normally a person that went to the chiropractor. So I went to the chiropractor a few times, and the pain got worse, and a noticeable limp occurred. Well, I went to the Henry Ford Allegiance Spring Arbor facility medical center, and they took an X-ray, and I was diagnosed with avascular necrosis, which is when the blood supply is cut off to the hip area. So that's when I started the journey, really to have both hips replaced. I really followed the doctor's advice. They talk about the exercises to do before, the exercises to do after, and I did those. Having the surgery, is going to give you that opportunity. But really, I feel for me that it was the physical therapy and what I did after, actually before and after the surgery, is what's helped me, feel that much better. My limp is almost gone. I just feel like I have more energy. I have a daughter that's 9, and it was difficult for me to get out in the yard to play basketball with her, just because, my limp. I limped. I was in pain, and so this has given me really a new lease on life.